Health officials this morning are warning about measles, calling it a renewed global threat. This after millions of infants missed their first dose of the measles vaccine during the pandemic. The CDC says in total, around 22 million children missed their shots. Now, that's just 3 million more than in 2019. So millions of people do not get their immunizations on time. But measles is one of the most contagious viruses. It's also deadly and easily preventable with the vaccine. So joining us right now, Dr. Payal Adhikari, a pediatrician with Child and Adolescent Health Associates in Chicago. Dr. Adhikari, listen, I think that this is a huge, important story, but can you just give us a little context? Because clearly, even before the pandemic, not everyone is getting these vaccinations for their babies. Why?
There's been a lot of skepticism around the MMR, or the measles, mumps, rubella vaccine in the last few years. There was that, study that has since been debunked from England that talked about the association with MMR and autism. And I think that really put a lot of skepticism in people's minds that, perhaps they should delay or even completely refuse the MMR vaccine for their babies.
And it's interesting because you bring up this point about people being skeptical long before COVID-19 vaccine. There was this movement. I mean, we heard the term anti-vaxxer being thrown around. A lot of parents believed that holistically it wasn't appropriate to give their children a vaccine. It could cause other health issues down the road. But how many people die from the measles every year?
So according to the CDC and WHO, in 2018, 140,000 kids died from the measles.
Wow.
So that is a lot of children, and this is a very vaccine-preventable disease. And most of these cases happen in parts of Africa and Asia where vaccination rates are very low.
And here, the cases have not gone up. So this is a very preemptive, preventative step by the CDC because they're not seeing a spike in measles cases. They're just concerned because 3 million more children not getting the immunization compared to 2019 is the highest number they've seen in the United States since 2020. Is that correct?
Yeah, so there was a huge rise in cases in 2019 or 2018 in the U.S., and then since then it's gone down. So 2019.
I know, keeping all the years straight.
Yeah, so it's gone down. But, the truth is, as millions of kids are missing their vaccines, the herd immunity rate really goes down, and that's what we count on for MMR. MMR vaccines usually start at age 1. They can be given as early as 6 months. But generally, from age 0 to 12 months, these kids are not vaccinated. So we need about 95% of people to have their vaccinations to get the herd immunity to protect all the unimmunized people.
Do you think that a portion of the folks that did not choose to get their children this shot perhaps didn't go to the doctor because of the pandemic, kind of eclipsing other health concerns? I mean, were people exchanging the vaccine for COVID-19 for any other vaccinations because they were just, babies couldn't and still can't get the vaccine. So what's the story here and how is it linked to the pandemic?
I think back in early 2020 when the pandemic was just starting and people were terrified, right? Like people weren't leaving their homes. Our offices were empty because we didn't know. We didn't know if they were transmitted just by walking down the street or being in an elevator with somebody. So people did miss a lot of their routine visits to get their vaccinations. After we kind of realized more about how COVID-19 spread, that the regular appointments really picked up. So I think that it definitely contributed to it, along with the vaccine skepticism as the COVID-19 vaccine came out, and there was a lot of misinformation about vaccines in general. People, I think, are more skeptical about getting routine vaccinations, too.
And your advice as a doctor would be for people to actually take their babies into their pediatrician's offices and get this shot?
Absolutely. Get their shots, get their growth and development checked. That's what we're here for.
All right. Thank you, Dr. Adhikari. We appreciate your time.
Thank you for having me.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.